Good morning, I'm Dr. Amy Capuccia. Today is Wednesday, March 1st. We're going to be discussing basic diabetes, diabetes care, and really just getting an understanding of what actually diabetes means. I have plenty of patients who come to me saying they've been diabetic for years, and yet they don't really understand the mechanism of their illness. So diabetes is a chronic degenerative disease, which means you will have it for a long time, and it means that it can worsen over time. So a lot of patients will come in and say, I've never needed this much medication, and they're very frustrated. So the number one thing is most people will end up needing some kind of medication further down the road, but if you can get control of your illness sooner on in the disease process, then that's going to be always much better for you. So first things first, what is diabetes? Diabetes is basically an endocrine problem. There's a dysfunction. Sorry about that. Let me try that again. All of a sudden we went dark. That's not going to. The problem with live video. So the problem with diabetes is you don't have a good ability to process starches or carbohydrates. So the most important thing for most people to realize is that there is going to be some dietary changes. It doesn't have to be terrible. It doesn't have to be the end of the world. You will have to cut back on carbohydrates, starches, sodas, sweetened things, because what happens with diabetics is you can put all that into your body, but unfortunately your body has zero idea what to do with it. So you put in a starch or a carbohydrate, it goes into your stomach, it then gets absorbed into your bloodstream, and unfortunately your muscles are resistant to insulin. Your organs are resistant to insulin. And this is type 2 diabetes, the most common. So what happens when you put that starch or that bread or that pasta or a lot of rice, so even if it's natural from the ground, does not always mean that your body is going to be able to process it as well. It definitely processes it better from the earth. It's not broken down, it's not overly processed. Your body will break it down a little more slowly, so it won't release the sugar as quick. So with type 2 diabetic, that starch goes into your bloodstream, and now it's trying to get into that cell. Glucose does not just diffuse through a cell. So water will pass freely. Some other ions, some other salts will pass freely through the membranes of cells, but unfortunately glucose is not one of those. So what you need is this neat little gated channel on the outside of your cell, and it's got a little door on there, and then insulin goes and hits that door, opens that door, and then the sugar can pass through into the cell. That's a perfect world. Diabetics, you have that door. Now this door is sticky, so you have a little insulin on there, and it's bouncing off, and it's kind of open, but not quite all the way open, and it's getting more and more resistant, and you need more and more insulin to overcome that gate, so basically more force from that insulin to open that gate so the sugar can pass through. So what we use a lot of times is a medication called metformin, glucophage. It's got a couple other names too, and it can be used in combination with multiple other type 2 diabetic meds. So in type 2 diabetes, that's that insulin resistance. The insulin's hitting the gate, not opening it all the way. So we have another medicine come in from the other side, relaxes that gate, basically greases up that joint, helps that cell and that gated channel to respond better to insulin. So you have the medicine here. This opens up better when the insulin hits it, and now your sugar can go through. So that's where we use the metformin. There's other ones like Actos and Avandia that are also help sensitize cells to insulin. I'm not going to go into all the mechanisms of every drug out there because there's unfortunately a ton of diabetic drugs. So this is just your basic on why we choose some medicines in the beginning rather than just saying, oh, you can do it with diet alone. Ideally, diet alone would be fabulous. And it really does work for a lot of people with mild or early onset diabetes. But that's where that metformin comes in, and that helps your body to use the insulin much, much better. So what else happens in type 2 diabetes is insulin, you can become insulin resistant just with increased weight gain. It seems that there's some chemical composite in abdominal fat that makes us more resistant to insulin. So that is why most physicians will push really hard for you to do a diet and exercise program with your diabetic training and diabetic education. So the diet for diabetics consists of lots of really good, whole, clean foods. So we're talking vegetables, fruits, nuts, berries, lean meats. So it doesn't mean you can never have red meat. We just want you to do a leaner cut of red meat. I don't want you doing the 80% meat, 20% fat burger. I want you doing a 90% meat, 10% fat burger if you're going to do a burger. I want it much more lean, and I want you using a real thin bun or no bun at all. I want you adding a lot of vegetables to that. And potato chips don't count. So you can do a lot of vegetables. You can fry, saute, steam, bake, grill vegetables as many as you want. So vegetables and diabetes go perfect together. Fruit and diabetes, most fruits go really well together. The ones you want to watch are the higher sugar ones, bananas, mangoes, pineapple. A lot of the tropical fruits are higher in sugar, and they're going to make your sugar go a little bit higher. Anything you do in excess will make your sugar go higher. If you eat a whole watermelon, your sugar will go higher. So watermelon is okay, but really you want to watch that serving size and keep it to, just the serving size. So with the type 2 diabetes, good foods, whole foods. When we mean whole foods, we mean fresh from the ground, not processed. So if it's got more than 5 ingredients in it, you probably don't want to eat it. If you can't pronounce foods in it, you probably don't want to eat it. It's not going to be as healthy for you. It's not going to be as health-giving for you. So that you just want to choose things that are more natural, more from the earth, more from the ground. Stay away from a lot of the processed starches and sweets. Type 1 diabetes is a bit different. Type 1 diabetes means your pancreas didn't work at all. So you either got a virus or an autoimmune disease that knocked out the function of the pancreas. So the pancreas is no longer producing insulin for you. So therefore that gated channel still won't work even if we gave you metformin, even if we gave you some of the other insulin sensitizers. The unfortunate thing with type 1 diabetes is the only way to treat that is with adding insulin. So, and it's not as scary as it used to be. It's not these gigantic needles like it used to be. They're teeny, teeny, tiny. I mean, they're the thickness of my hair, and they're only a fraction of an inch long. And they have these new pens that click, and you can inject much easier. So it really isn't as painful as it used to be. We also have insulin pumps, which are a really neat thing, but we're not going to go into all that right now. I just want the basic understanding of difference between type 2 and type 1. And then there's almost a blending of that later on in type 2 diabetes. A lot of people's pancreas will burn out over time. So if you are an uncontrolled diabetic long enough, or just unfortunate enough that you had extra stress, or maybe you were put on some steroids or something like that that caused your pancreas to, overproduce insulin and it burns out a little faster, you can be a type 2 diabetic on metformin and some of those insulin sensitizers, and then there's a bunch of other different medicines we use as well, who then needs to add insulin in because your body stops producing it. So this is, again, just a brief intro into diabetes, understanding it. The other thing I want to mention real quick is a hemoglobin A1C. I've got a lot of patients who come new to our office and they don't know what their last hemoglobin A1C is. That's just your basic measurement to, as your red blood cells float around, they pick up little particles of sugar and portions of that blood cell get coated in sugar. That's called your glycosylated hemoglobin, or hemoglobin A1C. And the goal for that is to keep the percentage of sugar on that red blood cell less than 7. So less than 6 is normal, less than 7 is a controlled diabetic. If you are 80 or above, we allow, 8%, is fine, because as you get older, the danger for low blood sugar is worse than as you're younger. So your doctor will talk to you about that. If they don't talk to you about that, I want to empower you to ask about it, because the only way to really truly understand your disease is to ask a lot of questions. So don't always wait for the doctor to tell you everything. Feel free to ask. If you don't understand, think of it like meeting with a teacher. If you don't understand something, when you're done addressing any major concerns, then ask your questions. Ask, well, what does that mean? What does that test mean? And if the more you know, the better control you're going to have over your illness. So again, that's just a brief recap of type 1 and type 2 diabetes, with that, blending, not quite type 3, but type 2 diabetics on insulin. So insulin is the major differentiator with those two, whether your body produces it or doesn't produce it. So I hope that answers some questions today. I know it was just a glimpse into things, but feel free to send me either a private message or just even write some questions underneath the blog, and I'll answer your questions to the best of my ability. Have a fabulous day.